The outbreak of the avian influenza strain H5N8 in wild birds in Uganda and a recent contemplation by the government to lift the ban on poultry imports from Uganda has got stakeholders worried of the devastation it might cost the industry.
When this kind of virus comes in, the egg, the meat, which is a major source of protein, will be devastated. When we look at the livelihoods, we are talking about this from the perspective of the fact that we are not so sure whether these strains are finished. By the time you get a small strain coming in, it will mutate and multiply, and a lot will be affected.
Any bird flu outbreak within Kenya would lead to massive poultry deaths due to the poultry population having no natural immunity against the disease and neither having ever been vaccinated for its prevention.
Experts are warning that the strain of influenza virus has no vaccine and is capable of infecting human beings.
It is one of the highly pathogenic avian influenza strain, so it can evolve, as I said earlier, if it gets genetic changes, it could be even a threat to human health.
They are calling on the public to be cautious and observe the ban on cross-border trade in poultry until the international health bodies clear Uganda of the current avian influenza threat.
The general population, if you happen to see any of these signs or any dead birds, please don't rush to slaughter the bird. It's what we call a notifiable disease. Make sure you get to your veterinary officer or to any livestock office near you and just make report, because we are also at risk and we can't ignore that fact as well.
The stakeholders want to be involved in the recently formed National Avian Influenza Task Force so as to provide input in surveillance and management of the situation.
Perpetuation of market disruption, especially of eggs, which happens anytime eggs are offloaded into the Kenyan market. This concern is worsened by few data on official entry.
The areas which are at risk, they are on spotlight, they are being focused, and surveillance, active surveillance is being done.
The H5N8 was discovered to have infected wild birds, including terns that died on the wetlands around Lake Victoria in Uganda last month, which led the government to banning any imports from the neighboring country. Judith Akolo, Channel 1 Business.